Okay, so assalamu alaikum. Well, in this video we'll take a look at the muscles of the pectoral region. So there are four main muscles of the pectoral region, and we can name them as pectoralis major muscle, pectoralis minor muscle lying deep to pec major, subclavius muscle, and serratus anterior muscle. So one by one we'll talk about the origin, insertion, nerve supply, and action of each of these muscles. So the first one is the pec major muscle. अब इसकी origin कहाँ से हो रही? It is originating from the medial 2/3 of the anterior surface of clavicle. Along with that, it's also originating from the anterior half of the breadth of the manubrium sterni and from the sternum itself, and also from the first 6 costal cartilages. So all this is the origin of the pec major muscle. Now where is it getting? One more thing, it's also getting originated from the aponeurosis of the external oblique muscle of the abdomen, which will be studied in the abdomen and pelvis region, right? So this whole is the origin point of pec major muscle. Now where does it get inserted? It gets inserted on the lateral lip of the bicipital groove or on the lateral lip of the intertubercular circles of the humerus. So in this way we have the origin and insertion of the pec major muscle. Now let's take a look at the pec minor muscle, which lies deep to the pectoralis major muscle. So it's getting originated from the costochondral junction of the 3rd to 5th ribs, right? Now the point where the ribs meet their costal cartilages, that is called as the costochondral junction. And this muscle, the pec minor muscle, will be originating from these points, and it will be lying deep to the pec major muscle, and will be getting inserted onto the coracoid process of scapula bone, which is the bone of the back, right? So this is the origin and the insertion point of the pectoralis minor muscle. The next is a very small muscle called as the subclavius muscle, which is getting originated from the first rib at the costochondral junction, just like the pec minor. बल्कि वो तो आता from 3rd to 5th rib, और ये आ रहा from the first rib, right? 3rd to 5th rib, right? This is coming from the costochondral junction of the first rib, and it is getting inserted onto the subclavian groove, जो कि होता है on the inferior aspect of clavicle, which we saw when we studied the clavicle as well. So the next muscle is the serratus anterior muscle, which is a very bulky, a very, you can say, diverse muscle, and it is getting its you can say origin from the outer surface of the 1st to 8, and it's having a very diverse origin and will be inserted onto the scapula at various points. So the first division will be inserted on the superior angle of scapula. The 2nd to 3rd division will be getting inserted onto the medial angle or the medial border of scapula, and then the remaining 5th to 8th divisions or 5th to 8th strips will be inserted onto the inferior angle of scapula. So in this way various parts of this muscle are getting inserted on various parts of the scapula bone, right? So in this way this muscle is having its origin and insertion. Now if we talk about the nerve supply of each of these muscles, so the pec major muscle is having its nerve supply by the medial and lateral pectoral nerves, which are the branches of the brachial plexus, जो हमने आगे study करना है. And the next muscle is actually supplied by the medial and lateral pectoral nerves once again, which are, we have seen, are the branches of the brachial plexus. And the next muscle, subclavius, is getting innervated by the nerve to subclavius, again a branch of the brachial plexus from its upper trunk. And the last muscle, which is getting innervated by the long thoracic nerve, and the root value of this nerve is C5, C6, C7, right? So C5 will be innervating the first 2 digitations of this muscle, C6 will be innervating 3rd and 4th digitations of this muscle, and C7 will be innervating 5th to 8th digitations of this muscle. Now what are the actions of each of these muscles? So as you can see, this muscle will be contracting as a whole, it will be adducting and causing a medial rotation of the arm at the shoulder joint, right? And when only the clavicular part will be contracting, it will be causing extension of the flexed arm against resistance, and it will be helping out in climbing process, right? So it also acts as an accessory muscle for forced inspiration, right? Actually all the muscles of pectoral region are helping somehow in the process of inspiration or forced inspiration. The next muscle is actually the pec minor muscle, which is due to its attachment on the scapula, it will be causing the scapula to be pulled forwards, right? And also acts to depress the point of shoulder, right? And it also helps in forced inspiration, just like the pec major muscle, right? And then the small muscle, that is the subclavius, it steadies the clavicle during various movements, and it is just an accessory muscle that will also be, you can say, forming a cushion for axillary vessels and divisions of the brachial plexus. So the next muscle is this muscle, and it is also called the serratus anterior muscle, is also called as the boxer's muscle, because it will be required for pushing and punching movements, for the protraction of upper limbs. So and it will also be causing the pulling upwards of the acromion process of scapula because of its attachment on the scapula, right? Muscle actually also steadies the scapula during weight, right? It will be steadying the scapula just like subclavius steadied the clavicle, right? It will also be helping out in forced inspiration. In fact, all the muscles of pectoral region are helping somehow in forced inspiration, because they are present in the thoracic region as well, so it will help, they will be helping out in that process. So these all were the muscles of the pectoral region. These are the origin, insertion, nerve supply, and action of each of these muscles. I hope it was helpful for you. So thank you so much. Allah Hafiz. Take care of yourself.